I am a community relations consultant for Anthem Blue Cross Blue Shield. I do have the pleasure every day of working with Tanisha. So part of what we really wanted to see here is obviously COVID-19 has extremely impacted the community for 4 years. I mean, ever since its inception, I mean, it really just came out and really dominated. And very much so in a lot of senses changed the way a lot of us, all of us, I would imagine, globally live the way or how we live our daily lives, essentially. Obviously, time went on. We've seen a lot go on during the summer, last summer, a lot of things. And more recently, we've seen what I feel like is a light at the end of the tunnel, the vaccine being available, multiple of them. So what we felt like was very important for us to do as from an HMO perspective is really have a transparent conversation with community members about what we're seeing and really kind of use the community-based organization, the community leaders that are kind of firsthand dealing with COVID-19 and its impacts to kind of get their perspective on things. Because our goal, obviously, at the very end is to increase the vaccine, to decrease vaccine hesitancy and hopefully increase our community where, if you look at the data, it's most prevalent in our communities that many of us live in. So we really want to encourage as many people as we can to kind of get out and, not necessarily get the vaccine, but obtain more information about it. So again, it's not our goal to say, hey, you need to get the vaccine. However, we want to arm you with the information, accurate information, for you to make the best decision for you and your families. So we're going to go ahead and start here. So again, my name is Marvin Hanna. We have Dr. McManus. If you could just, Dr. McManus, if you could just give a brief introduction about yourself and kind of what motivated you to agree to sit on this panel this evening, discuss COVID-19.
Okay, hello everyone. My name is Pat McManus, born and raised here in Milwaukee, which I'm not that old, I look old, trust me. Father said, and my grandson's got to be quiet, he may have a comment, but he's not allowed to speak. But I do think that certainly something as important as COVID, it does tie into who we are, especially as the black community here in Milwaukee. It's another, COVID wasn't specifically let's go in and kill black people, as I heard people say that. But are we ready? Were we ready? My answer would be no. Our community was not ready. Even as far as what public health was doing, they were not making our community aware of a lot of things going on. Okay. Oh, do I need to have this?
Yeah.
Okay. And so my organization is the Black Health Coalition of Wisconsin. We started in October. We celebrated 33 years of being around, and over those 33 years, we had different things that we've done within the community that we know is important. Usually, it's about things that folks don't know about that we then intercede in. So we've scaled it pretty much, looking at what's going on. What we do now is community education, basically, and advocacy. Advocacy takes a lot of our time because we're working with child welfare. We're working with other places that we know are taking our children and causing a whole lot of problems with them. We're helping families try to keep their kids. In education, your question about why do we do this is because, as I mentioned, health education is a major component of what we do. We talk about everything related to health. So certainly when COVID came up, it was just natural for us to get involved in it, and especially the way it came in because of the previous president and all the negative information that was put out there, which is still out there, and you have people who are just not responding. If they don't want to take the vaccine at all anyway, then they've got good information. That way it's good information, not that it's accurate or right information, but they use it. And we received a grant from the state, and what we wanted to do, we knew there were enough people to go around and give the vaccines. What we do is education around COVID. I have a Facebook Live program that I do every Saturday, and so for the last year, I've been using COVID as the topic for people, and I get a lot of feedback from people who say they appreciate getting the same information. I'll just say one more thing is that I was just talking to them. I have a granddaughter that's lived with me for about 6 years now, 7 years, and she, I try to talk to her about getting the vaccine. She's no. I was telling people you can't get mad at them or yell at them or put them out. I was telling her I would just do every week, 10 days, I would say, what time was that we had to schedule for you to get your vaccine? That she just look at me like, yeah, Granny, okay. Walks into my house 2 days ago. She'd gone to see a doctor for something else, and it's a nurse practitioner who we both actually have. But she comes back and she says, I just had my flu shot and I had my first COVID shot. I said, what? So no matter what I said, and not that she didn't understand what I said, but having somebody else, that's the whole point too, that she got there, so I was just stunned and pleased, obviously, but we could talk about the other specifics about it, and certainly the misinformation and disinformation that's out there around, and they wonder why we have hesitancy, but we as a population, we're the last for anybody to do anything for, so why should we think that people care about who we are?
Thank you. You can pass it to Bria. So Bria, along the lines of the same question, introduce yourself, what do you do, and then kind of tell us a little bit about your motivation for joining us this evening.
Mm-hmm. So my name is Bria Grant. I'm the executive and founder for an organization called Unite WI. We do work around data management of social determinants of health, identifying community-based solutions, identifying systems gap, and encouraging policy change to support the findings. And so it's a no-brainer, right? A lot of our work is serving in the gap for our community. We lend our credibility to a lot of issues on behalf of systems and stakeholders and public health to communities of color, disenfranchised communities, and marginalized communities. And quite honestly, we have been providing a lot of education, as Dr. McManus stated, around COVID vaccination, COVID education. I've been in Milwaukee all my life, but I'm from Indianola, Mississippi. And I have to say that because there are some core pieces of me that I'm just real. I'm hesitant too. And I had to say, wait a minute, public health. And you're not going to force this down my people's throat. And I understand the goal that you may have, but we're going to walk this thing. Right, and so one of the things I'm really, really mindful of is that education is still progress, right? And so sometimes we just want to watch. And I remember having a conversation with my grandma who picked cotton and worked for the master and nursed his babies and all that, and she said, I'm not taking another one of his vaccinations. And when she said that, I mean, that's my grandma, I left the conversation alone. All right, grandma, I ain't gonna say nothing else to you about this, even though Biden said 70% by July 1. She didn't care anything about that, and so as a number of my elders in the community, right? So how do I serve in the gap? How do I represent public health as a woman of color, as well as respect the space of my elders, who quite honestly, I don't know what kind of remedies they helped me get through my cold, through my sickness, but whatever was in the cup grandma gave me, it worked. She was not a doctor. She was not as learned as some folks will call it, but we recognize the trauma. We also recognize the advancements in medicine, right? We also recognize that, it's just not a magic wand to say, okay, I trust you now. Right? That trust takes a long time. And it's kind of, in some ways, saying, I know you had an abuser, but I want you to go back to the house and stay with him. Right? It doesn't work like that. Right? And so we need to make sure that as we work to lend our credibility to systems and stakeholders that quite honestly fund our work, that we're authentic and who we represent. And so we have been leading this charge at the state and local level around policy, around implementations of strategies, around messaging to communities of color, while recognizing that this is a serious issue. Right, the disparities that have long impacted our community. It's not new, the disparities that were highlighted as a part of the COVID news and coverage, right? People on the ground already knew that communities of color led in diabetes and hypertension and cardiovascular disease. This is water is wet news, right? Now our European colleagues are like, oh my gosh, we didn't know. Well, we already knew that, we were trying to tell you. So how do we leverage one another, right? And so I'm always excited to have an authentic conversation about leveraging resources, about leveraging authority, right? Because here's an opportunity for us to transfer power, right? Systems recognize that it is not so easy for us to give a directive to citizens and that they adhere it. Wash your hands, practice social distancing, wear your mask. Or they gave those guidelines and everybody was like, who are you? What you telling us to do? We don't even know you. But they recognize that, hey, we gotta deploy these organizations on the ground. So now they see their limitations, and I'm here for it. I'm here for all the transfer of power, all the transfer of wealth. Anthem, thank you very much for all the dollars they put into our community, because we have been asking this for a very, very long time. And it wasn't until it hit the front doorsteps of our world that the people in the ivory towers paused and said, wait, we ain't been doing something right. And so I'm here for all the conversations related to my community and making sure that we can stay educated.
Leroy, same thing. Introduce yourself, tell us a little bit about you, and then kind of tell us about your motivation for joining us too.
Leroy Butler, former Packer. For me, my mom was, she raised five kids in the inner city in the project, so I grew up poverty. And I remember she was talking about leadership, and she was telling me that, to be a good leader, you once had to be a good follower. You got to choose the right people. If you want to follow, choose the right leaders. And I just remember going to school, I always got vaccinated. I never asked a question, because my mom said, you got to get vaccinated to go to school. Fine. And when this happened, I think the sports world, and the reason why I'm here at Marvin, mainly because Tanisha made me. And that's my boss. She said, here's your schedule, go there. But I'm just kidding, I love her. But for me, the reason why I'm here, I think is impactful, because I think when you look at sports, people think we're above that, and we're not. No. But it's a lot of athletes had some hesitancy about the vaccine. I leaned into it. I couldn't wait. When I was eligible, I wanted to be the first one in line, mainly because I love people. I make a lot of appearances. I went to get my booster shot because I love people. I want to be here. And then wherever I go, whatever your protocol, mask, I follow it. That's how my mom taught me. So I love people. So my son, I took him the other day when he was eligible, and he's, well, are we gonna get a flu shot? And then he looked at me, Dad, it don't matter, because you got it. So it got to be safe because you got it.
Absolutely.
So I said, well, he's 10 years old, and then the next thing you know, I don't tell people what to do, but I got 15 to 20 vaccine events, because I want people to see me as a leader. And it is politics, but I don't care. If you don't want to get the vaccine, I ain't talking to you. My mom used to say, mind your business, but the education part of it was quick for me. It was quick, because I really love people. I love to be out. I love my family. And I thought the only way to do that is I went to MCHC, Hyatt Pharmacy. And I said, Doc, he said, come on with it and we'll figure it out. Come on. So I went, got it, no problem, booster. I wasn't sick, my arm wasn't hurting. Because there's a lot of things, everybody different. But I just wanted the best way for me not to go to the hospital. I'm going to do whatever I can, because I love people. And that's really my job for the community. And a lot of athletes wouldn't want to sit here today because they don't want to be judged either way. God's the only one going to judge us. And I feel good about that. And you pray about it and you let God handle it and you move forward. But this has become, especially outside the African American community in the sports world, is huge. Because the Green Bay Packer quarterback, Aaron Rodgers, had to go through it. And he apologized for misleading people. It's been some players had some fake vaccination cards. That's a federal offense. So, but it's always going to be that. But bringing it back to me, this is me personally. Not only was I thankful for the vaccine, but it gave me an opportunity to not walk up to people and feel weird about it. But if I have to go into a protocol and have to wear a mask, Fine. This is my daughter, Danielle. I got 6 daughters. Only 3 of them I really like. This one that I like. Don't tell them, though. Don't tell them. But you know how they say you're not supposed to have a favorite child? I have a favorite. He's my son.
Absolutely.
No, I'm just kidding. But she was hesitant now. Now this my dog. Dad, because she's a fireman. I don't want. I said, okay, fine. So then, if you don't mind, HIPAA law, she got COVID. Daddy, you was right. Then she got vaccinated. Then I started cash apping her again. I turned the cash app off. If you're not gonna do what I tell you to do, you do what I tell you to do. I turn it back on. See, we put humor in everything because now my mother-in-law, she's squirming because she's like, don't be all that. Because this is my father-in-law. My wife will be here shortly. But to wrap it up for me, it is about leadership. I lead by example. And ultimately, the reason why I did it today, because I don't want people to see all the community leaders and who's going to represent the athletes in our community on the north side. Now, we're not in the suburbs. And to bring it home, it's in a barbershop. Where's the best conversation? The left side of the walls for the women get their hair side. The right side, and my father knows this, is guys arguing about sports. So this is impactful, it's important, and I'm just glad to be here.
Thank you.
So who follows Leroy Butler? So good evening, I'm Wanda Montgomery, and I am a founding member of Black Child Development, Milwaukee affiliate. I last year became board president emeritus. So we are 27 years old. We've been a volunteer organization in the city of Milwaukee for all of that time. But in the last year, we have established an office and are now hiring staff as we build capacity to do more work in the Milwaukee community. My life, born and raised in Milwaukee, just celebrated 67 years on this week. I'm not afraid to tell my age because I'm blessed to be here. That's right. There are a lot of people that did not make it. But the work that we do in Milwaukee is to improve and advance the lives of African American children and their families through education and advocacy. And I'm gonna take this piece of mint out of my mouth so I can talk. We have spent, and I should say I have a side job that many of you know. I'm actually the president of the Village of Brown Deer. That's a side job. But that side job puts me more in a leadership position in Milwaukee County. I'm the first African American woman to be elected in Milwaukee County to lead a municipality. And right now, I'm the only black woman in the state that leads a municipality. And so when COVID hit last year, that first weekend when they began to shut everything down, all of the mayors and village presidents had to come together to say what we were going to do. And I can't go into all the detail, but my heart, my mind, my work is all about black children and their families. And so if I'm sitting in the room with all white folks and they telling me what we got to do or what we gonna do, I always have to push back and say, well, wait a minute. We're the ones that are affected. And y'all may not remember this, but COVID, they shut down everything. I believe it was Friday, March 13th. What was coming up the next week? Do y'all remember? St. Patrick's Day. St. Patrick's Day is the biggest It's the 17th or 16th, 17th or 16th, 17th. But it is the biggest moneymaker for folks in these bars.
Yeah.
And so we had to make a decision whether or not we were going to shut the bars down. And I'm sitting there listening to these people saying, well, you know, this is when we make our money, and this is when we, and you know, and so I let them all talk. And I hadn't been village president, but just a little bit over a year. And I said, folks gonna die. And I can't sit here and not speak up, because people are gonna die for what? Some alcohol? Because you're gonna lose a few dollars? And when I spoke up, another mayor spoke up. But I'm going back to kind of Alexander Hamilton. You got to be in the room where the stuff is happening. If you ain't there, it will happen. And so that's just an example of my side job. But as it relates to black children and their families, we have done a number of programs around educating our families, and we got to go where they are. We know they can't come together. So we've done webinars. We've enhanced our Facebook page. We've enhanced our web page. I'm right now working on a national proposal that will help us to expand it, not just for Milwaukee affiliate, but for all of our affiliates across the country, because we're trusted voices. There is no other organization in the country that represents black children. They got black in their name. The National Black Child Development Institute. If y'all got one, tell me where it is, because I ain't seen it. The other thing is, we have the only curriculum for parents that are for black families. The only one in the country. So we are going to build on the capacity, and Bria can testify to this. We implemented it 3 times last year with families virtually. And it's 12 weeks, 12 weeks. But I can tell you that when parents finish that curriculum, they said, can I take it again? And I'm looking at them like, what? Who wants to take another? So we let them take it again, but as an audit, not as the, we didn't want to pay again, so we'll let you audit it. But what I'm saying is people are hungry for the information, but they want to get it from somebody they trust. Somebody they trust, somebody that they see. And so as COVID began to, the numbers began to rise, I found myself on the news, on these daily briefings, you know, telling people to wear masks. I started pulling out my old skills, making masks again. So I made probably 1,000 masks, and I gave them to children, because in the beginning they wasn't giving masks to kids. And I said, I'm gonna make masks for kids. And then, so we just kept that going. And as we are continuing our work, we're gonna expand it. You can go on our website now and see webinars that we taped, where we even had children that got their vaccinations, and they said why. And I'm with Leroy. I love people. I love to be out. I love to hug folks. So when my opportunity came to get vaccinated, when I went back and got the second, and I just happened to walk in the village city hall in Brown Deer one day, and they was giving vaccinations for the booster. I ain't had no appointment. They didn't know who I was. I just walked in and say, y'all giving boosters? They said, I said, can I get one? And they looked at me and they said, well, let us check, because they have so many prevail. So they said, yeah, I got it right then. So we have to, if we're going to be leaders in this community, we have to set the example. Don't lie about it. Tell the truth, because when you lie, it's going to come out. It will come out. And so, and I come from a large family. We got 9 siblings. I want to spend time with my mother. I don't want to be standing outside the window looking in. And that's the way people need to understand. This is not about one person. It's about a community. We need to help each other. And as we help each other, we will help our community. Thank you.
All right, so Pastor Fuller, the same thing. Tell us a little bit about yourself and then kind of let us know your motivation for being here.
Right. Hi, my name is Pastor Mose Fuller. I'm the pastor of the St. Timothy Community Baptist Church. I've been pastor in the church since 1993. And before that, I was a firefighter for the Milwaukee Fire Department for almost 28 years. And so I've been around. And one of the things that really helped me when I think about, this pandemic and how this pandemic started and how it affected everything. I looked at it from that perspective that, everybody here hasn't lived through anything like what we're going through now. I mean, that's just a fact. And so now this disease, this pandemic, it's a universal disease everywhere. I mean, you think about the psychology of a pandemic is that everybody in the whole world is suffering from the same thing. So now, when you do medicine, I think you have to look at that a little different. And the way that it affected black people is that, a lot of disparities existed in our community, with how we deal with our medicine, our health, whether it be diabetes, high blood pressure, or whatever it is. It's kind of like we was always, there was a dysfunction there. So the pandemic just showed up all of that. And so one of the things that I think that really helped me and my wife, we talked about it. This is my wife right here. We talked about it and we said, so what I was thinking as a pastor and how they wanted all the churches to shut down and all of that. So we didn't close all the way down. A lot of people didn't come, but we stayed open. But we did what we had to do in order to stay safe. But here's what I was thinking. I said, I really can't wait until there is a vaccine developed. See, because when one is proactive in his or her health, then, they're going to do some reading. They'll go to their doctor's appointment. That's important. On the fire department, one of the things that we learned when we went into people's houses is that a lot of people were not proactive with their health. And that's a dysfunction. That's a malady in the community, and a lot of people are sick. And just because you don't go to the doctor, that don't mean there's nothing wrong with you. You're just not going to the doctor. And so that was a problem. So we knew that. And one other thing that really helped me is when this pandemic hit, one of the first persons, I believe it either was the first person or the second person in Milwaukee to die from the pandemic was a firefighter. Yeah, that's right. And I worked with that guy. And so it hit me, it hit home. And then the other thing was black folks were dying more than anybody else. And so as a pastor, so my position is that I'm pro-vaccine. I mean, I'm not trying to force on anybody, but I'm not going to be waiting around because I believe in taking medication when it can help you. So me and my wife had discussed that, and so that was my stance, and that was my sermon, so to speak. And so then those are the type of things that I talked about. And then if I'm going to lead from that area, I have to lead from the front. That's right. So if I'm not going to tell you to get vaccinated, then I'm not going to get vaccinated. And so I lay it that way. So I just think that's what needs to be done. Now, when we look at this, when we look at where we are with this pandemic, when we do medicine, we really can't do it the normal way because nobody living today has gone through what we're going through now. So I think that's significant. When we rationalize about how we're going to do things, we have to look at it like that. One of the things I heard about this pandemic and see is that the problem today is the reason the cases are higher today is because folks that are getting sick are the ones that have been vaccinated. Now that's one of the problems here. But then because it's a worldwide disease, see, we really don't get well until those folks in the deep reaches of places where they can't get medication are able to get the vaccine and get well. I heard a lady in Africa, I think it was Uganda, and she was talking about, she said, you know, that was back last year, and she was talking about the pandemic there and about the inability of people that live way out in the bush. And she was talking about that. She said, yeah, people like in America, like all of these modern countries, they can get the vaccine. She said, but that will not eradicate the virus unless people that live out in the bush are able to have access to the vaccination just like everybody else. So as I close, one of the things also that helped me is that not only did I know people that had got it earlier, and I worked with a person with Pastors United, Pastor Lewis, and I told him, Pastor Lewis, I said, man, I'm going to tell you right now, you got the disease and man, you almost died. He was on his deathbed. But here's the thing about that. Here's the, you know, when Pastor Lewis got sick, we was having meetings and I was sitting right next to the guy. Now that's how good God is. See, I was sitting right next to him. And I said, man, you got this thing, and I'm right next to you. We breathing on each other every week. But you see, I didn't get it. That I know about. I could have gotten it because the disease was here before we knew it was here. And all of the politics that was behind it, you know, which didn't make any kind of sense. So in order to be the leader that you need to be, you got to rise above that and try to help as many people as you can. And as a pastor, that's the most important thing, is to help the people, to let the people, you know, do what they need to do in order to get in order to get well. So I just think that, man, I'm pro-vaccine and I'm here because I think that God would want me to be here. Now, if Jesus was here now, he would be sitting on this stage. But since I'm his ambassador, and you know, I mean, really, I'm his ambassador, so I'm here. So I just think that I have a charge, so to speak, to talk about it, to tell folks that, you know, to get the vaccine, because, you know, you don't want to get sick. But the doctors say that what you don't want to do is get COVID-19, because we really don't know all the stuff about how that disease works.
Can we pass the plate now?
All right, so I think, so we're going to go ahead and get started with some of the questions here. Just specifically to these questions, we got a ton of content to get to, so I would ask that you keep your responses, if possible, to 2 to 3 minutes per response.
Okay, you get this to me, so that's most general. You just tell me not to talk as much.
Oh, no, not at all, Dr. McManus. It's just a general rule for everybody. No, absolutely. All right, so Dr. McManus, we're going to start with you. So one of the first questions posed was COVID-19 cases are on the rise here in Wisconsin, and Milwaukee County is currently leading in both confirmed diagnosis and death. As of 11/17, almost 10,000, COVID has claimed almost 10,000 lives. When you think about that number, how does it make you feel?
Well, I think anybody who works certainly in the health community understands what that is and why. I think the problem is the majority of us as health professionals, as well, your doctors, nurses, or whatever, aren't in positions to make a difference in what happens when you see that. I think that's part of my frustration. Ours is to try to keep people from getting it in the first place. And I did forget to mention that my granddaughter did get COVID first. And then 3 months later now she took it, but she survived it, which was really good. But I think that living in Milwaukee, because I made that as a comment first, is key for black folks, because what we have to understand is that we're looking at not just a pandemic that hit, we're looking at 400 years of being in this country. And if you understand trauma and stress and health, we already are talking about immune system, which is key to how they even set up this vaccine. Your immune system is shot. My immune system is shot, and a lot of it has to do with what we have to put up on a day-to-day basis, the racism, the historical racism. And unfortunately, sometimes people are like, well, see, we can't do anything. I've had people say that to me. We can't do anything. And my always response, yes, we can. We may not do exactly what you do, but our problem is that we as a community don't give up on us. We can do more. And when we do it, we all always actually do it pretty well.
Absolutely.
But in our minds, we listen to the larger community who has no thoughts about who we are, but they are the ones that run stuff, you see. And so you think that the people, because they run stuff, they also have power. We have more power. We have more power than they have. But we don't understand that. And I think that's part of the reason why we look now and they say the unvaccinated are the ones that's going to keep people from herd immunity. And that probably is true, but they're also the same ones that can build our health if we just get them to not listen to all that other stuff. And that's hard, but not impossible. Yeah. You don't give up on it.
Absolutely. So I'd like to hand it over to you, Bria. Kind of the same question, hearing that number, how does that make you feel? And also just adding on, how has it impacted your life?
Marvin, I just don't know how to be anything but authentic, right? And so, we hear the number, and I'm in my community regularly, so I hear a lot of different thoughts, right? Some would say, well, tell me how that compares with our annual death rate, right? So how many more people have died than the typical average number of people? Some would also say, okay, is this a diagnosis that's being added to death rates because there is a higher reimbursement, right? So we like to have real conversations because it's easy to have pretty conversations about, and I'm not denying that these numbers are not real, right? I'm talking about what our community is questioning, because that's what this is about. I stand in the gap for my community. I want to be very, very, very clear on that, right? The positions, the conversations, the thoughts that I have are because I have a lot of conversations with people across the spectrum, right? From doctors, from CEOs, to people on the block saying, listen, you getting ready to tell us to listen to the white man, Bria? Let me tell you what he did to me. I went to court, blah, 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 blah. And I can't deny their experiences, right? I can't dismiss the theories that folks come up with. And then all I can say is, let's make sure we have strong immune systems. Let's make sure we have healthy eating habits. Let's make sure we are exercising. Let's make sure we're taking our vitamins. We're going to see our primary care providers. We're utilizing health care appropriately, right? Because all of those things are things that we've neglected to conversate about. We got so lost into the weeds of things, and I just have to say that, how do we prevent it in the beginning? How do we make sure that if we contract COVID and whatever other disease may come across, that we have a fighting chance to survive? And a lot of that comes with proper eating, which we do a really, really bad job of. Thanksgiving coming up. All the staple foods in communities of color are bad for us. Macaroni and cheese, fried chicken, fried everything, right? Look, I know. I told you I'm from Indianola, Mississippi. We eat good down there. We eat real good down there. No, that's what I'm talking about. She said it's good, but whether it's right? Exactly. And so I like to have a different conversation. I can't talk about the numbers. Quite honestly, that's done. Right, whatever put on the birth on a death certificate, whatever aggregated numbers for our death rate is what it is. How do we prevent it? How do we build our community in a way where we can be healthy? Because the reason why white people ain't dying the way that we were dying is because they have a different lifestyle. And it may be because it's privilege, right? Because it's expensive to eat healthy. I don't know why avocado is so high. I don't understand it. I don't know why it's more expensive for a bottle of water than a can of pop. I don't comprehend it, right? I know why, but this is where we need to have a conversation, right? So we can talk about the numbers all day. It doesn't change the fact that those numbers exist. How do we change being the next number? And so that's the conversation I'm always looking to have.
Yep. Dr. McManus, back to you.
Oh.
We're going to rotate
Oh,
this.
okay.
Yep, we're going to rotate. Yep, we're going to rotate. So it'll come to you after Dr. McManus, Mr. Butler. So one of the next questions, Dr. McManus, was prior to the vaccine being available, or when articles started coming out about it, was researching it to understand if it was the right fit for you. Was that a big component of you of your work prior to actually getting the vaccine?
Oh, yeah, it actually, it really was. I mean, we have to think about, it's not just the numbers, although I think numbers are important, is that it is the overall piece. And for one thing, because COVID came when the idiot was still the president. Y'all know I don't need to say his name, right? Okay, and so what he did was not about the things you're talking about, the things that I talk about, because it was all about politics for him. And I think that did put a drag on when we get to where we are and where we're getting better, is because of that. And I know I was one. I did not get my first shot till February. They would start giving them out, October, earlier, right there, and I'm sitting there looking, and even my granddaughter, I said, nah, I'm gonna look at it for the first. I'll make sure that they got it with people and with folks who know what they're doing. And I think that is one of the problems, one of the major problems. And I think it does account for the numbers of deaths that we have now, and it does account for the more deaths, because we do have, I'm going back to, I'm talking about now, but our immune system makes a difference. And we've had very poor immune systems for, again, that whole 400 years. It's not going to change overnight. But for people to learn how to do things differently, I think is extremely helpful. But and then let's not leave Milwaukee out, and especially the city of Milwaukee, out when it comes to black folks. And who cares about us? The folks who have most of the big jobs and the big money is not us. We have, the mayor, no, I don't think much of him. So I have no problem talking about him. I'm happy. I feel sorry for the Luxembourg people, but I do want him gone, because he does not care about us. He uses us. Every time it's time for him to get elected, he goes where he tells his phone. I'm telling you, this is nothing I wouldn't say in his face if he was standing right here. It's the mayor. He come to our church. We think we got to stop doing that stuff. We got to hold these folks accountable for us. And he knows that, so he gets his staff to list all the black churches, and then he goes around and meets them all, and we all get excited. But that's part of who we are, is that we do care about people and who's supposed to be important. But when it gets to the point that it blocks you from seeing what's going on, that's when we're in trouble. And I think Milwaukee, we see that more here than almost any place else. When you have a Casey Foundation, which is one of the largest children-driven foundation, say the last 4 years that Milwaukee is the worst place for African-American children to live. That's a number that we shouldn't be throwing away. That we have to think about that, and we got to do it ourselves, and we don't have people in positions that can do that, because most of the time the politics require them to do what the politicians say. Kiss butt. I've never been able to do that. I guess I can't been that far. But I see a whole bunch of people who do it that then affects us. It affects us as a community. We can talk all day about what people should do and what they should eat and what they should do. Should they take the vaccine, not take the vaccine? But until they realize that they need to take care of themselves and take care of their children, understand what that means. And a lot of our families don't. It's not because they're ignorant and don't know. We actually have systems. And my PhD is in healthcare systems, so I tend to push that, right? We got to understand how systems operate and don't operate for us. That it's not going to change. We can go this now. We're looking at probably another year of COVID. Now they're talking about measles. I don't know if you heard about that, but that's the next. They're talking about measles now because we got a whole generation of people who didn't vaccinate their kids. So they're looking now at having measles and the pandemic at the same time. You don't think that's not going to hurt us? It absolutely will. But we need to have more people who trust, and don't trust us because we're black, but trust us because we care. And that we've done things before to get people to kind of understand, and we advocate. Like Bria says, that's what she does, that's what we do. That's what, excuse me, that's what's happening, I think most of us up here. Every week I have to listen to the pastor over there because he gonna make sure. you know, because I'm part of Pastors United, you know, so we go make sure we talk. I just tell them don't kill anybody in the process and make sure it gets done, right? But I'm saying that we have to have, like, even this community talk. It's unfortunate we don't have more people here, because I think this is what people ought to listen to. That they really do. Maybe we could try this even again. I don't see this as not being good, because it is.
Yeah, absolutely.
But I think it pulls us together to say that we need to have more of a conversation. We need more people to hear, more people to trust us that we know what's going on. Because we can go to school and get all the degrees in the world. I got 3 degrees from UWM and applied for a job, but they wouldn't hire me. Now that's real Milwaukee, right? Now that's real Milwaukee.
So I'd actually like to pass it to you, Leroy. Same question. Was researching, prior to you getting the vaccine, was researching a big component of it for you?
I'll be honest, not really.
Okay.
No, it was a trust factor.
Okay.
'Cause I think, to me, once I get saved, I don't need to get saved every week. You give it to God and you move forward.
Yeah.
And I did that. And the people who passed away, and I would agree with you, I'm looking to stop the next 10,000. So these kind of panel discussions, I think, will help prevent that. And it was heartbreaking to see anybody pass away. But I try to stay laser focused on a problem. I remember my mom telling me, she said, we got all these problems in the house. We got all these problems. The sink doesn't work. The bathtub is backed up. I didn't do any of those, by the way. We need air conditioning. We need all these things. So instead of worrying about all these things, her getting overwhelmed, she said, I'm going to go one thing at a time and stay focused so I don't get off track. And she started fixing things. Because I think that sometimes, because one of the barbershops I was going to, we had this discussion, it was an open discussion. And they were saying all the problems we have in the community because the young man, the young Dolph got shot. And there was a young that said, we kill our own kind. And then we worry about somebody else, but we do it to ourselves. So I was like, so if I didn't tell my brother, because I'm like, Miss Wanda, I love to hug and talk to people. What's the best way for me to do that? So I tell them about me. And then I try to stay laser focused on this. So I don't get sad, because otherwise we'll be here all day as people saying, how can we do this? And the reason why I drive from Oak Creek to Milwaukee, because I want to be with people. And it did hurt me, because I grew up in a community like Milwaukee, and it's kind of segregated, rich people here, and just because this is down south. So when I go to Florida, they didn't have any protocols. In Jacksonville, people were dying, all races, they were just dying. They didn't want to wear masks, and I was like, well, maybe if I record my shot, maybe it'll help somebody. And it did. They said, well, if he can get it, I can do it. If you can do it, I can do it. So, and I want to say one thing real quickly. I want to thank, she's too modest, because we went to people to do, me and my brother-in-law, Jaton Davis, to do a football camp for $35. There's nobody can do a camp for $35. These camps are $2,000 or $3,000, and some of the inner city kids couldn't afford it. And this hero gave us the platform to do it, and all the kids came. And this was in the pandemic. We were doing this at Brown Deer School. I said, well, we're going to do it. Miss Wanda, I got a place. But we need this. Oh, I know them too. And we got it down for $35, and I appreciate it. That's the kind of leadership. And the last thing I'll say is what my mom used to always tell me. Real heroes help people who they do not know.
Yes. Yeah. You can hand it to Wanda. So, Wanda, along the same lines, we've definitely heard Dr. McManus, Bria, and Leroy just kind of let us know just not only what's been kind of influencing the trajectory of the current pandemic, but also noting the historical aspects as well. So one of the questions that I would kind of want to hear your perspective on is kind of knowing all that and looking at where we're at with vaccines being available, and even hearing the numbers and that. Do you feel like it's headed in the right direction? Do you feel like the pandemic is heading in the right direction, with the ultimate goal of being obviously defeating COVID-19?
Well, if we listen to what the news said today, no, it's not heading in the right direction. The numbers are going up. And when I think about what we need to do, the numbers are going up, 10,000, 20,000, 30. I can't fathom all of that. I think about Roberta Lyles. I think about Cheney Whitehead. I think about Ophelia Williams. I think about Catherine Pfeiffer. These are women that I knew that were all 80 plus. One was 95. Living their life. But COVID took them out. And so we think about the big numbers. I focus on the people. Because if I can touch or impact one person, and when these women, most of them lived in their homes, and then after they passed, people trying to figure out how did they get it? Because somebody that decided they didn't want to get the shot, but wanted to be around them. And so we have an opportunity. It's an old saying, each one reach one. We have an opportunity to tell the truth, talk to people in love, and let them know. I have 3 adult children, 3 grandchildren, son-in-law, daughter-in-law. We didn't have to force anybody. Probably the one person that had reservation in my family was my husband. He's like, well, I don't know. And then he I want to get just the Johnson & Johnson. I just want one shot. I don't want nothing. And I'm staying home so I don't have to worry about it. But I'm going out, And he's like, well, if you come back with it, you're going to have to stay in the other room. But I'm going to tell you what got him to get it. Our grandson, who's now a freshman in high school, wanted to go back to school. And my husband is his driver, picks him up from school. So I'm sitting in another room listening. And my son comes in and said, I want to go back to school, and he can go back starting the next week. And he said, so you going to be able to pick him up? And I could hear my husband, kind of like, The next day, he tells me, he said, well, I got an appointment to get my shot. I said, when? Today. So we've been married 48 years. I couldn't convince him to get it. But his grandson, because he wanted to go and pick him up from school. So we don't know who's going to be that trigger to get. So we all need to be talking to somebody. We put everything, all of our life on Facebook. Everything. Some stuff don't need to be there. But when I got my shot, I had them take a picture when I was getting it. Put it on Facebook. Because I know somebody, you never know who you're impacting, who's watching you, who believes and trusts you. And then they come back and say, oh, I got my, or ask me, where did they get theirs? Or where did I get mine? Because they wanted to go. But we have an opportunity. This is a venue. I know they're recording it. They may play it back somewhere else. Play back this information to people. Tell them what you know. And don't sugarcoat it. Some of us, I didn't get sick, but I got sleepy. I was just tired. But nothing significant. That's a big difference than ended up in the hospital on a breathing machine.
That's right. That's right.
So I think as we see the numbers going up, and it's in our community, put a face to the numbers. Put somebody you know, somebody you love to those numbers. Don't concentrate on the 10,000, concentrate on the one. What did Jesus say? He went and got that one. So we have to get that one to make that difference.
So, Bria, we're moving into another segment here, and one of the questions posed here, and it's kind of a continuation of what we've been talking about already. Even with vaccines being available in communities, do you see us returning back to normal? If so, what does that look like for you?
Yeah, I was gonna ask you that question. What is normal, right? So getting back to normal, right? Some people will say time heals most things, right? And so when we think about things like polio, it took a long time not to just get the vaccination, but it took a long time for us to eradicate polio, right? And to get back to what people will say was normal after 60 years, right? So we create new norms all the time, and I don't think that people will say, "Oh, you look crazy for wearing a mask." That will probably be a normal thing for some people. Here's a sidebar, right? I don't know if y'all remember, Michael Jackson used to wear a mask all the time. All the time. Everywhere he went. Right. You see him out, you be like, "Oh, wow, why he got that mask on? He must be sick." No, he was like, "Y'all sick." And his thing was, this is what normal behavior needs to look like for me. And we thought he was crazy. Right? So now we're all like, "Oh yeah, let's get our masks." We got them decorated. I got a Dave Chappelle mask. It's my favorite one. I have a whole lot of them. I got them hanging on the side of my little knob on my car, because you never know where you're gonna go. And they had a sign up like, even if you're vaccinated, you need to put your mask on here, right? So there are going to be some new norms, and that just happens in society, right? We get new information, we shift. Right. And it's nothing wrong with that. It's not to say that we created a new normalcy. We got information and we adjusted to the information that we got. Now, I kind of feel bad sometimes when I don't wear my mask. Let me tell you about Miss Wanda, because I would go to her house. You got to stand outside early in the pandemic. You stand right out there. I got this plant for you. Wait, I'm gonna bring it to the door. Like, oh, okay, I can't come in. That was something. I was like, this is gonna be a new normal. People are they're gonna be hesitant about allowing for you to come into your house. Even if you are vaccinated, they're gonna be like, because Aaron Rodgers lied. Yeah. So no, I can't trust anybody. And you just stand right there, and I'll bring your plate for Thanksgiving to the door, right? That's a new normal where people are like, we're virtually connecting for holidays. That may not 100% shift back. And that's okay. What we need to do is adjust. And when we talk about adjusting to what our new norms are, how do we support people that don't move as fast? And making sure that they can still be supported in what they're accustomed to, right? Because just because we say, "Oh, everything is going to go virtual and that's the new norm," doesn't mean I know how to respond to that. So my thing is, we recognize that this might be something that's here. How are we stakeholders, IA, Anthem, and all those other powers that be that want to make sure we stay well and don't cost them money? How do we make sure we're supporting, making sure people can adhere to your guidelines? How are we making sure that folks that are in their homes have access to internet, have the ability to connect virtually, have the understanding of all the things that we need them to understand in our new normalcy? That is my position on it.
Love it. All right, so Pastor Fuller, on to you. So there is still some reluctance to get the vaccine for some individuals in the community. I'd like to know how you have being the head of a church, how have you personally navigated that with your congregation?
Repeat the first part of that question.
Absolutely. So just basically saying it's still some hesitancy out there in the community.
Well, it would really be nice as a pastor if I could say people really listen to the pastor. But I understand that's not a reality. That's really not a reality. You know, I think pastors sometimes are the last one that people really want to listen to. Let me just say this when we talk about the pandemic. I think that God is not on the outside of what's taking place in our country, what's taking place in the world. He's involved in this and he's in control. That's a reality. That's a fact. So the issue is how do we deal with it? So as a pastor, what I do, and I think what all pastors do that might take the position that I take, that are pro-vaccine, that I think that one should really become vaccinated in order to actually save their lives, enhance their chances of surviving, and not infecting anyone else. See, I think when we're in this pandemic, we really can't afford to be selfish. I think we really can't. And I think that you know, and you at the same time when you speak about this thing is that you have to take people's feelings into consideration, but at the same time, you have to deal with a fact. And so what is the fact, Pastor? Well, the fact is this, is that when people get this disease, they can die. That's a fact. And so then the other fact is, it's a new disease. And we can't ever forget that. It's a new disease, and we know a lot about it, but we don't know everything. And we don't know everything. We don't know everything about it. And the other thing is that I think is really important is that not only do we not know everything about the disease, but we don't know everything about the lasting effects of the disease. See, so then as a pastor, you want to see, so what is my work as a pastor? My work as a pastor is to tell somebody what you don't want to do. You don't want to get sick. And so the reason I say that, because that's what doctors say. And see, I believe in doctors. I don't believe in all doctors, but I believe in doctors that has the best interest of the community at heart. And I think that if you have a relationship with your doctor, I think that you can understand what a good doctor is. And I remember and I'm going to start with this, I remember when I first started on the fire department, and you know, when you first start on the fire department, then you want to get you a good doctor. I got a good doctor. He was a black doctor. His name was Dr. William Walker. He was one of the first doctors I had, and Dr. Walker said, he told me one time, you know, I had high blood pressure, and you know, and this guy, and I didn't know I had high blood pressure, and I went to my doctor. I was in my early 30s. And he said, man, Mose, you got high blood pressure, man. And he said, he gave me this medication, and he helped develop high blood pressure medication. And I didn't want to have high blood pressure. And because I didn't want to have high blood pressure, I didn't want to take the medication. And so he gave me the medication, and I didn't take it, and I went back, and my blood pressure was up, and he got mad. He said, Mose, you haven't been taking this medication. And I, you know, that was the last time I did that. So you know, really having a good relationship with a doctor is important. So I tell people as a pastor, man, what you need to do, if I can help you any kind of way, is to say something to you that can help you to not get sick and be in a hospital and on a ventilator and having a disease that you might recover, but then after you recover, the doctors don't know a whole lot about the lasting side effects of COVID-19. That's what I would say.
All right, so I know we've kind of already, Dr. McManus is back on you. So I know we've kind of already talked about, I know Ms. Wanda had mentioned the specific situation with her husband and vaccine hesitancy. And I know, Leroy, you mentioned your daughter was definitely hesitant about it. But the question is more geared around So we've seen a lot of articles about not gathering for family holidays in large groups, and it's really regarding vaccine status or lack of compliance to the vaccine. So one of the questions that I think it would be helpful to kind of talk about is how do we navigate that within our own families? And some people believing that the vaccines work and they're effective, maybe others don't. How do you navigate that? Can you give us any advice on that?
Well, I think there's no one way, that's for sure. And I think it really probably depends really on how the family navigates everything, not just the pandemic. What were they doing before that? And I think about my own family, because I have a lot of family in Minnesota as well as here. And so it was all virtual for a lot of that in the first place that we did that. So when we had to adjust to one house, when folks are making things good, I only have to do the fried corn now. I had to cook a whole lot of other stuff, but I'm the fried corn person now, So those were adjustments, but watching, especially, again, the younger people, my grandsons and, whatever, that if they're around somebody all the time already who, as the pastor's been saying, whatever, if it's been done with them, they already have something in their mind already. Even, like I say, even my granddaughter, she didn't want to let me know she was thinking about it, but she was, And even right now, I didn't say anything earlier, but I have a sister that's in the hospital now with COVID, and she didn't go into the hospital with COVID. She got it in the hospital. You know what I'm saying? I mean, so I'm, of course, being my usual calm self, having a fit out there. Not now, because I want y'all to take good care of her. But when she comes out, and it looks like she's come, but it looks like she's going to have that long haul kind, because it's already been 2 months, and they can't get her off the breathing machine, or not well enough for her to go home. And they can't blame on the family, because no family was allowed to be in there when she first came in. But what happened, and I know what you say, it was bothering me, because she's one of those outside part of the family that you don't see all the time. We all got those, right? Okay. But something said to me, because she didn't have she's got her and her kids, she doesn't have a car or anything. So before she went into the hospital, and she was in the hospital for her kidney and her heart, not her lungs, right? Excuse me. And so something just said, I just called her on a Saturday, and I'm like, matter of fact, I was in an NAACP meeting, I forgot about that. But anyway, I called her and said, y'all, come on, I'm taking y'all to Walgreens, y'all getting your shots. And that was when they were talking about the $100, but they ended up not even getting the $100. But I took her up there, and actually, it was she had like 4 months. Don't get me started with that. But when it was time for her to get a second shot, was the time that she was having problems with her kidneys in her lungs. She was kidneys in her heart, that she was withholding a lot of fluid that she couldn't get rid of and whatever. So they asked her, of course, when she came in, and they gave her second shot. Now, they tested her when she came in. She was not positive. 2-3 weeks down the road, she was not positive all the time. They've done the surgery for her. They got everything, getting ready to put her in a step-down unit, and she's starting to fall apart. And they're like, well, what's going on? And then one of the doctors said, do a COVID test on her. And we did one, no, do one. And they did it, and boom. That's what it was. Like I said, really, like in the hospital. So we're figuring out now, well, what do we do with her? Your question, still, she's family, still. How do you get your family in all these different places? And you just have to, DoorDash or do whatever you go do. DoorDash yourself, but do whatever, how you going to do, because we wouldn't want her to think we've forgotten about her because she's there. But how do you do it when you have, I've talked to other families, we talked to a lot of families, and a lot of them talk about how, like you mentioned, there's a change now that people have done, how you do things now, the family gatherings. How do you get people who can't go? How are the folks who you may not even they're a member of the family, do you still let them in the house when they're out there doing stuff they shouldn't be doing? Unless they get vaccine, take the vaccine, or unless they do something. It's setting up different rules within a family, I guess is what I'm saying too. And sometimes folks get upset about it, but you love them, even those ones that you're hard with, and saying, look, you're in there with all these other people, but don't mean I don't love you, but you have to have some rules around what you need to do. And we tend to, just as like folks in period, our rules kind of blend with how our our family is, as I started to say. So clearly, I think almost anybody can't say that it's the same now. Somebody had to make some kind of change to adapt, to make it adapt, you know. So I think that's one of the main things, even not dealing with, there's not a whole lot you're going to be able to do with the doctors, you're going to deal with the other people, they're going to do what they're going to do, no matter what. But I still do think that information is still extremely important. And we've had a lot of, we in the last year, we have education to about 1,200 people already around, which, and they'll call back, and because we do it virtual, but they'll call back, ask other questions. They're interested in it. Because I think we also tend to think that our people aren't interested in learning. I mean, that's some of that negative stuff that people say all the time. And we may not want to know what they're doing, but they get to, once they get this, and even now, more people are asking now, because it's gone on long enough now that everybody has been affected some way. And if they tell you, I haven't been infected, you just check to see if they're still breathing, because that's just not true. Even if they don't want to admit it, some people don't want to talk. Now, I've seen that. It's not just a vaccine hesitancy. Some people don't want to talk about it at all. You know, and it may be because somebody died that they didn't treat them right and they didn't have a chance to feel better about it, or they died of COVID, they didn't get it. You know, we didn't know. I've dealt with some people with that as well. How do you deal with that? But the thing to know for sure is, like I said, we still got another probably 9 to 12 months just with COVID, and not to mention if in fact they're predicting that the measles piece may come in now, because we do have like 1 or 2 generations of people who, a lot of them did not get measles vaccines for their kids, and they're adults now, and can be, and so they're like, what? Now we're doing this. A lot of stuff is happening, and I just get so upset with living here, I think, all my life, because it's harder for us to do things for our community that we want to do, because they still want to schedule strict things the way everybody should get it, and you can't do with us. We're very, you know, we're people who deal with people. That's good or bad. You know, that's who we are. They tend not to be that way. Let's just deal with, as you mentioned, the numbers. Let's just talk about this way should things be done. That's not how we do it. We got to have a relationship. Relationships are extremely important with us. And so I think we just have to push that more.
Great. So, Bria, I want to kind of turn it to you. So I think Dr. McManus had kind of already touched on it, and I think she made a great segue that I really want to hear your perspective on. So there is a lot of vaccine hesitancy out there, and a lot of that is compounded with fear about the vaccine. So my question to you is, how do we truthfully address that fear that exists around vaccines in general, specifically for a COVID-19 vaccine? How do we truthfully address that?
So Marvin, I heard that question. Can I hit one point and then hit that question right? Let me first say the slippery slope of relinquishing our freedoms is based on fear, right? So you want to take away a person's freedom, scare them. Right? We did it with 9/11. We did it with a lot of things. I don't want to say that that's what's happening now, but it's often a strategy. But I want to hit on something Pastor Fuller stated, right? One of the things that's really, really important, and I don't think we really internalize it, is really pushing our communities to take careers in health and public health. Reason why that's important, because we all want to plug. I want the doctor to give me the insights, right? Because I can't trust some people, the doctor. But Leroy, being my doctor, I know he's going to hook me up. He going to tell me what they said in the meeting. He going to give me the insight. He going to give me the background information that I'm not going to find in the book, on the web, on TV, right? And because I have that relationship with him, he's going to make sure I am straight. And so one of the reasons why I got the vaccination, albeit very, 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 very late, very late. It probably was like a month and a half ago that I got the vaccination. After coordinating almost, how many Pfizer vaccination clinics did we coordinate with Hyatt? More than 100. We coordinated more than 100 vaccination clinics across the county, right? And it was only because, one, a doctor friend of mine that's black, that got a really, really good relationship with, that I don't want you to die. I was like, all right. I was like, all right, I'm gonna go ahead and get it. I done watched it a little bit of time. That's matters. But we're not pushing our community into those careers, right? And no knock to sports, but that's what we hanging our hook on, the fact that I hope you go to football, I hope you be a basketball player, I hope you be a baseball player so we can get a meal ticket. Or no, I need you to be a doctor because I need to know what's going on behind the scenes. I need somebody to give me some insight. So I want to encourage us to push our community to go into the health and public health careers. Epidemiologists, most of all of them whites. I need somebody else giving me the data. Just because you might not count like I count, right? You might not interpret that percentage the way that I interpret that percentage, and I need you to understand my language that I communicate in. Then I want to touch base on what Dr. McManus stated, right? So here's the slippery slope of social distancing and social isolation. One, social isolation can cause other chronic conditions, right? It can cause cardiovascular disease, hypertension, a number of other things that we haven't even addressed when we talk about social isolation. But here is the elephant in the room. We talk about the increase in violence. Somebody didn't rob you because they got a praying grandma they going to see Thanksgiving. Yes. And that praying grandma gonna look at them and say, boy, and that's all they got to say. But I can't be with you this Thanksgiving, grandma. So guess what? I'm about to hit a whole bunch of licks because you're not in the back of my mind. This is something that systems don't even understand. Right? So when we talk about social distancing and our culture, we're communal people. We survive by being together. That is how we've been so resilient through the 400, 500 years of terror. Right? We've been only able to do that because we gathered in the backwoods. We gathered in the basement. We gathered at the kitchen table. And now you're telling me I can't come over my granny house. We don't look at it like that, and I'm not saying it's wrong. I ain't saying it's right. I'm just saying what is, right? So we talk about, how do we get this spike in violence? Oh, my gosh, it's going crazy. It's like, yeah, because ain't nobody seeing that grandma. And it's a song say, I got a praying grandma. That's a real thing in communities of color. Okay, so your question about fear and hesitancy, because I'm a mama, we got to remember all the things that we got to address. Fear and vaccine hesitancy, I struggle with this. Dr. McManus brought up the $100 gift card, right, for getting vaccinated. And I'm a board health member for the city of Milwaukee. Transparency, we had a meeting because it was suggested that we give incentives to people for the vaccination. And one of the things that they did with Tuskegee, they said, we're going to give you free health care. Here you go, you're going to have a doctor's visit. You ain't got to worry about that. Your family going to have a doctor's visit as well while you injecting me with syphilis. That's why I got free health care, so you can observe me. So when we begin to capitalize on poverty,
Don't forget they're going to bury them. They buried it.
they buried it so not only are you going to get free vaccination, free health care, we're going to make sure your funeral is taken care of. Dr. McManus, yes, they did that as well, right? So when we began to disseminate a message that capitalizes on poverty, I'm always hesitant about what that does on the background, right? And this is why our community need people to say, okay, I understand the information, I know what we need to do, but I also see this other side, and I need you to roll up all your sleeves. Leroy, let me see what you got up under there. This is what we got to do for our community. And we have to help them understand, maybe we don't want to tell people I'm going to give you $100 to get vaccinated, but if you happen to get vaccinated, we want to incentivize you for making healthy decisions. That's a different narrative, right? Two different things. You're going to pay me to get vaccinated? I don't know about that one. But if you educate me and say, you know what, I just want to incentivize you because you received this education, you thought about it, and you made a decision that was best for you and your family. And we got a lot of money, we can give you some, right? That makes a world of difference. You're not capitalizing on my poverty or my fear, right? Now I can build a little more trust in this thing. Because the question would be is, why you want to pay me to do that? Why do you want me to take this so bad that you're willing to cut me a check? Why you want me to have have participated in this study so bad that you're willing to give me free health care and bury me and my family. These are things that we are so quick to forget as we initiate and facilitate the conversation of systems and stakeholders that want a quick fix to something that they don't understand. Instead of saying, hey, y'all, we don't know what's happening. Give us some time. Let us try to figure out this thing. Let us understand. But what we do know work is washing your hands. What we do know work is it's spread through air particles. They kind of flipped on that. They didn't know, right? But what we do know is this, but it's a whole lot of stuff we don't know. And I don't know, we just need you all to trust the fact that we're trying to work it through, but we don't have it 100%. These conversations help anybody gain trust, right? It makes me say, all right, you're honest in the fact that you're trying to get a handle, but you don't know how. All right, let me take the vaccination. That makes a difference in our community when we talk about hesitancy. And it is okay for people to just want to watch. Dr. McManus said, I couldn't get it right away. I had to see, was it the administration? Are they injecting us with something? Well, let me see how many people get it, long as we don't have a class. And look, I got it saying, I said to Fazia, I said, oh my goodness, Lord, I hope we don't have a class action longer than 25 years. Because I'm telling all my people to do this. They gonna come knock on our door. They gonna say, y'all coordinated 100 vaccination clinics. And I did it because you told me, Leroy. We have to be mindful of those things as we respect hesitancy, as we try not to capitalize on fear, because that's a big motivator. Fear is a motivator. I tell my children, clean up your room or else. They don't want to know the or else, so they go clean their room. I really just want them to clean their room up because they need to keep their room clean. But it don't always work like that, right? So we use whatever we can to get people to do what we need them to do. And when it comes to our health, we probably need to be a little better in how we move that.
All right, Leroy, on to you. So starting off a new segment, social media is opening up new and innovative ways of connecting with people all over the globe. In knowing this, do you feel social media platforms have an obligation to its people to limit the ability to share inaccurate information regarding vaccines?
Absolutely. Yeah, I believe in, because I think when they brought all the tech companies in, it was asking them about some of the disinformation back and forth, and they have the Section 230 that they don't really, you can say what you want. And I believe that we have a program that Anthem actually supports. It's Butler versus bullying. Yep. But we also have a program called Make It Obsolete by Delete. What we're trying to tell people, if it's not true, just keep swiping or delete it. That some of this stuff you can check out, you can find out. Because I'm dead serious. It was a guy in the barbershop was telling people that if you take the vaccine, when he walked by, he was at Golden Corral and 500 spoons came to his body. And I'm like, so he posted that, it had over 2 million views. And I was like, people really don't believe. Come on. So, and that's what it is, because it was on World Star too. So, if I had a social media platform, you could have fact check stuff, but you can say all that, but people still want to. It's people standing somewhere now waiting for, like, dead people to come back to life to make somebody a president. I'm saying, so the responsibility is for each person. We never read the fine print. We never read the fine print. But if I had a social media platform, you couldn't do that on my site. You just couldn't. You just can't. And I'll be very honest, I'm a little bit different about the family thing. I want to get into that. And you can't tell people how to do their household. Everybody got different rules. Every company has different rules. The NFL, the NBA, everybody got different rules because that's their house. That's their house. Get your own house so you can do it. If you're not vaccinated, I don't want you in my house. But that's me. You don't have to come. We can still talk, whatever. Because I don't want the anxiety of it. But each guy that owns a young lady or owns a platform say, you know what? I'm not going to take the vaccine, but I'm going to cause a problem. I'm going to tell them all. I'm going to push all the disinformation. And it's up to people to just fact check out. Just pastor, you like pastor or reverend? Which I never. Do pastors like reverend or pastor? Pastor, okay. Because we say pastor down south. It's really to let people know that you're still my brother and my sister. We still love you. You just can't come on Thursday. That's why they have contactless. They drop the food off and you pay on the app and keep it moving. Just because we don't agree, don't mean we can't be brothers and sisters.
Absolutely.
And that, especially in every community, we still love each other. You give me information, I give you information. But if you see on Facebook, the vaccine does not make you put 500 spoons to your body. Who believes that? But he was saying it, and so Facebook took it down, and he tried to sue them. And not only did he not win, but they took the platform away from this guy. Because they say, you really, whether you're in for vaccines or not, you really shouldn't put out information like that. And I think that's a good thing. You can have a healthy discussion like we're doing today. Because this my sister, this my sister, this my sister, this my brother. But so is the young lady in the back, that's my sister too. Everybody, because when Jesus was leading, he didn't look behind him and say, only certain people can follow me. He just lead. Don't even look at the back. Just lead. Now he's walking and saying, I pray everybody's following me. But it's going to be a few people that's not. I pray for them too. And that's what my mom taught me. Once you get saved, you get to God, and you just lead, and lead. But when I was following, I chose the right leader. And these are the leaders I would choose to follow. Whether we agree or disagree, these are leaders. Because you tell me on a Friday night, we could be doing anything. But we're here because it's important to hear every side. And it's a healthy conversation. And I think I am very emotional that we have people here to have, this is impactful. Yeah. And I agree with you, Doc. We should do this a lot.
Yeah, absolutely.
So people can ask their questions and you can say what you want, whether you disagree. Because I think everybody should be a Packer fan. I do. But the problem is I got a nephew that's a hardcore Viking fan. He going through enough pain. So I got Bears fans in my family. We got Bears fans at our church. And I close by saying this, we're all in the same sandbox. But we have different toys that we like. Right. And we can all get along. And it's just, we get too tribal, like my way is the best way. No, it's not. Absolutely. You have to let people think for themselves. But again, on Thanksgiving, see, I'm about being comfortable. If you're not comfortable, you can, call, FaceTime. What y'all having? And I still love you. Because next Thanksgiving, we can all get together. And one of my mom used to always say, and this was before COVID, for our family reunion, she'd say, I hope everybody don't show up. Because they get on my nerves. They don't want to pay for these shirts. And we didn't spell their name right on the shirt. I just hope just my family show up. But we still love you. And that's what I want to tell anybody that sees this, vaccinated and unvaccinated, we still love you and we'll pray for you.
Absolutely. So we're going to go ahead and kind of piggyback off what Leroy was saying, Ms. Wanda, and then we'll go ahead and take a 10 to 12 minute break. For those of you who wish to grab a meal, you will have time to do so as well for the panelists as well. And then we'll come back and then do 2 more segments, and then we'll finish strong. So the question which was initially posed, which was kind of involving the social media utilization tool and kind of putting misinformation out there surrounding the vaccine. So my question is, do you think this is, having this misinformation out there has led to a lot of individuals not being as willing to get vaccinated because if they're seeing this information and this is what they're believing as their source of truth?
I think it does have an impact, and the reason is, as Bria said earlier, we talk about social distancing, but we're talking social isolation. There are people that are at home. A lot of people are single. They may have family, but the family's not local, and now people are working virtual, so they're at home. And Facebook, Twitter, Instagram is some folks, they best friend, and they get all the information from those platforms. And so as and I don't know if folks understand, once it's put out there, it's out there, but you can go and correct stuff.
That's true.
Or if I've had people, I have 2 different Facebook pages. One is official as an elected, and then my own. And I tell people, if you want to have an exchange with me officially, go on my president page, because I'm not talking to you official on my page.
Exactly.
Because that becomes an open record issue. But anyway, when people put stuff on your page that's not accurate, delete it or block it. Because if it's on your page, then they believe that you've co-signed and you agree with it. So we have to be mindful. Some folks, they put that there. No, they might have put it there, had it, or delete it. Because otherwise it becomes, and you got to delete the whole post. Now I know it's there, don't nothing go away, but at least for the moment, you can take it away from anybody else coming to see. So the other thing is, we know folks believe what's on Facebook because they take it from somewhere else and put it on their page. So you get this constant redo or repost of wrong information. And we know that even when COVID first started last year, folks had people dead before they died. Y'all remember that? They were dead before they died because people believed what they saw on somebody else's page. And so it can be harmful. It can be dangerous. And the thing that you want to make sure is that somebody that you know doesn't take that information and use it. And we know that this social isolation is dangerous because black people are committing suicide. COVID or not, because they're isolated and lonely. And we community. We want to come together. We want to be with each other. And so we've had birthdays on Facebook or Zoom. How many of y'all knew anything about Zoom before last year in March? Didn't know nothing about Zoom, didn't know nothing about GoToMeeting, didn't know nothing about Team, all of it. But now we know all of it. So we've had baby showers, we've had exercise classes. So we've learned we can do all of that through social media. But we have an obligation when we see wrong information to correct it or take it down, because you don't know who's buying into that. And yes, I didn't see the 500 spoons. I didn't see none of that. But you do see people that begin to talk about things like it's real, and it's not. They think it's real because it's on Facebook. and it's not. And so there's a responsibility too to those that own those platforms. But you know, they making money, so and what do they call it? Algorithms. You can think stuff now, and the phone will come up with it. So we know that some of the stuff that we may be talking about may come up, and then we start believing our own stuff, and it ain't true. So social media is a good thing, but it can also be dangerous.
Yeah, absolutely.
I just want to follow. I don't know if I watch MSNBC a lot if I'm sitting down watching time. I don't have a term, but I was most disappointed, and this was maybe a month or so after COVID got started. Dionne Warwick was on. I don't know if anybody saw that. She was on, and they were talking to her about different stuff. And I guess she was, I don't remember now, but she was doing some kind of thing with some rappers, which I really don't know about. I have to ask my grandkids about that. But they apparently didn't screen her, because then they asked her if she'd been vaccinated, and she said no. And then he stopped, because it's like he didn't know what to do, because he assumed she'd say yes. So he said, "Oh, you haven't had the vaccine yet?" She said, "No." And so he said, "Well, are you going to get it?" And she said, "I don't know." And he was stunned, looking, whatever. But she didn't say anything. I mean, she's cool. I really liked her, because that dude's kind of feed her, you know. She's like, so she didn't say, "I'm not going to get it," or "I didn't," because she said, "Well, I'm still learning and still doing whatever." But what was interesting about that, I mean, a woman of her stature, normally they would have shown that over and over and over again. You never saw it. If you didn't catch it that time, it wasn't there anymore, you know, which tells you something about these platforms and how they can control things. Because I said, well, if they're going to do that, then they need to screen people better before they put them on the air. But they made, because she was, you know, who she was, and she's black and all this kind of stuff. But like I said, but she was cool. I mean, she was very important. You know, she made it very clear that she just had not made up her mind. But she paid for it in that regard. Well, I mean, she paid for it. I mean, but it was interesting that, like I said, nobody else, they would have had 3 or 4 different places that she went to talk. They didn't do it at all. So that's the punishment you get for just thinking, you know, and saying, I'm not going to jump into it. But she said, "No, I'm just still thinking about it." That's what she said. And that is not the purpose of giving people information or denying people the ability to have their own opinion, whether you agree with it or not. You know, I think they lost a lot from her just by the way she was treated. So that's what I mentioned.
Yeah, no, I appreciate it. Absolutely.
Because, you know, often we talk about misinformation, but we don't talk about credible sources. So I just want to encourage people, you know, at the local level, your Department of Health Services is it's a pretty good place to go and get solid information. If you want to go at the federal level, the Center for Disease Control, and if you want to go at the global level, the World Health Organization are credible sources to obtain information related to all diseases, for that matter, and vaccinations and health-related information. So, you know, it is one thing to say, you know, don't believe it, but where do I get credible information? Right. We definitely have to equip our community with knowing where to go. And then the other thing, we have to be mindful about not dismissing things so fast, right? And as we were talking about social media, I don't know why, but Nicki Minaj's cousin came into my mind, right? And so, you know, we had a situation where she said, "No, I ain't gonna get the vaccination because my cousin had an issue with his testicles." And everybody thought that she was just like, "Oh my goodness, she's so stupid. Why would she say that? Blah, 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 blah." But that was an experience that he associated with the vaccination. And instead of us saying, is that a potential side effect? Are there some reproductive issues, right? Because I know women that say, after I got the vaccination, I had menstrual issues, right? My cycle was thrown off, and it was abnormal, and how do we know what those long-lasting effects are, right? So making sure that we provide credible sources for information, but also being mindful not to be so quick to dismiss a person's experience. No, it did not make you magnetic, right? Where you didn't attracted all the silverware in the restaurant. You a glowing human now, right? No, maybe not that. But there are some experiences that that people have adverse side effects that we're not all aware of. Like even our researchers are still trying to identify long-lasting what are going to be some things that we need to watch for. So I just wanted to kind of highlight that.
I appreciate that. So, so meals are being provided, but I was made aware by Tanisha that maybe someone in the audience I know I certainly have a question for the panel, but I just want to open up the floor if anybody does have a question.
Hello, my name is Soraya Murchison, on-air radio personality for HD Media, HD Radio now. And I am a COVID survivor, thank God. I am a COVID survivor. I survived it. And let me tell you, I'm also a kidney transplant survivor as well. Wow. As of November 30th, I'll be celebrating 11 years of a kidney transplant. And when I came down with COVID, I didn't have any symptoms, okay? And when I was encouraged by my transplant coordinator, doctor from Frederick, love that hospital, to go, get tested, they said, okay, well, Soraya, if we don't call you, that means you don't have it. If we don't call you. And the next day when I went to go get my blood labs, I have to go for my monthly labs for my transplant, they said, well, you have COVID. And I said, well, they didn't call me. And I said, well, how do I didn't have any symptoms or anything like that. So and this was actually a year ago, around this time, the day before Thanksgiving, I came down with COVID. Now, so I had to stay home. I couldn't be around my family. I love to eat, as you can see. So I missed dinner and everything, and things began to get worse. And when they told me that because I'm a transplant patient, I couldn't go back to work, not for 14 days, but for 30 days I was off of work. I was recently working at the radio station, 1560 then. I had to be off for 30 days. I'm like, okay, wait a minute, wait. I'm single, I don't have no income coming in, I gotta stay off work, but how many days? They said 30 days. So I went from bad to worse. Couldn't breathe, it was just terrible. Loss of taste, loss of smell, couldn't eat for 2 weeks. Literally, I lost weight. I was like, I don't want to get sick to lose weight. I need to lose weight. I don't want to get sick. So I was like, oh my God. So I had to go to the hospital because I was, I kept getting shortness of breath. So I was hospitalized for 5 dreadful days. I thank God I wasn't on the breathing machine, but they had to, help me with my oxygen or whatever. So, but my question is, when they had encouraged me to get the vaccination, and I was dreading to get the vaccination because I was wondering, okay, well, since I got COVID, you didn't tell me what to do to go home to quarantine. You just told me to go home. Okay, what do I go home and do? So, and then when the vaccination came out, it seemed as though I was just kind of doubtful myself, because it seemed like as though it just came out the air. It just happened just that fast, okay, get the shot or whatever. So I was very doubtful, but when I did get the shot or whatever, of course I had, I had some side effects or whatever, face swelled up, but I survived it all. But my question to the panel is, what happens what are your thoughts when someone does get vaccinated and they still, either transition or get sick? What are your thoughts on that for people that have been affected by that? Thank you.
Sure. Anybody want to take? So Pastor Fuller, then Dr. McManus. I'll come back to you.
See, that's what I said earlier about this virus. See, we don't know everything about it. It's a novel virus. It's new, and it affecting people in different ways. One of the things doctors are saying now, I've had 3 shots. I had the booster, the 2 shots, and then the booster. So then I could still pass it on. But one of the psychological thing here is that the way you look at the vaccines, that even if you get a breakthrough case, they're telling us that we don't get it sick or we don't go to the hospital like someone that haven't been vaccinated at all. That's a psychological boost for me. Now I like to go work out. And so now, before I was vaccinated and just wearing a mask, although I went to the gym, I went to Planet Fitness or whatever, I didn't feel comfortable. So you got to kind of like deal with people's heads. A lot of stuff going on in people's heads. They're thinking about it. I heard this, I heard that. And when this virus came, that was happening. That was, our country was all messed up that way. So as a pastor, so here's the way, as a pastor, here's the way I'm thinking. I said earlier that God is really in this thing. He's not on the sideline. So leadership is really everything. So when the pandemic came, our country did not have good leadership. That's a fact. So you can't lead a country based on lies. So God got all kind of ways of doing things. When you read the Bible, you see that. God know how to bring a leader down. And I think that personally as a pastor, I think that's exactly what happened. Is that God came into play, sent a pandemic that hadn't been around for 100 years to take place on his watch. And he didn't know how to deal with it because he was in over his head in the first place. So I think that that's important. I think you have to you develop a relationship with people. As a pastor, you develop a relationship with people and you kind of like talk to them about, like that. So that's what I would do. I would just, talk to them, like that to try to get a relationship and tell them that even though you have the 3 vaccines, I've had 3 vaccines, but the thing of it, I could still get sick. But in my mind, and that keep me operating and keep me doing things to stay healthy, is that I don't get so sick that I have to go to the hospital and be on a ventilator and can possibly die. So that would be an inducement to psychologically get people to move in that direction. In our family, we have all of our kids is not vaccinated. Really? And so now, and so that's an issue, but then we're not, you better go get vaccinated. We just keep talking about it, keep loving, and who knows what the Lord can do. And so that's the way I look at it. For the pastor, God is in it. He's not on the sideline. He don't hate us because people are getting sick and dying, but I think this is really important for me as a pastor is the type of leadership that a nation has. Man, that is huge. Leadership and see, people in this country, they want to believe a lie. Just because a person is a president, or just because a person got elected, then he can lie and it's still okay. And God, who's in control of everything, don't care. He does care because he cares about his people. Well, how do I know that? Because he sent his son in the world to die for me. That's how I know about it. So I can start preaching, but I'm not going to go there. But that's Dr.
McManus, did you have something to add?
Yeah, I was going to say that even part of the misinformation and disinformation that we get relates to what happens, because in some ways, folks who don't want to get the vaccine will listen to the ones that correlates with, well, don't take it. I mean, my granddaughter, I remember saying, if I said, well, if you get the vaccine, at least if you get sick, you won't die, because she was saying, well, getting the vaccine won't stop you getting it. They have their little lines already in terms of what they say. And I said to her, well, that's true. I said, but it will make a difference on you still being around when you're done. And I gave her some of the data I had when you look at it, between 1 to 200 versus, closer to 300 or 400. You got folks who died because they didn't get the vaccine at all. I said, this is what the kind of thing, and she's looking at me like, oh, I don't know why I talked to her. Because I haven't figured out how to beat her yet. I said, well, finish school, you'll be fine, you'll do this. But it does amaze me how many of our folks, if you really don't want to, you will find a reason why not. I mean, that is just going to happen. The best we can do it, just give people the right information as we know it, whether you agree with it or not. And as we say, don't argue with them. Don't tell them they're stupid or they're crazy, because that just bores people up even more to say, forget you, I'm not going to do it. No, you just say, okay, like I said, my granddaughter, every couple, 10 days or so. What was that? When did we have that appointment? I should know we had. She looked at me like, Granny, we haven't scheduled an appointment. I said, oh, I'm getting older. And then she looks at me like, yeah, right. That's going to make a difference. But I told her when she came and said that she got it, what I was of her, and let me know if you need to get the next one. I mean, that's all you can do. I got the other little one, and I think she's going to get it done. But we have so many who didn't like needles and vaccines even before COVID. So it's not all about that. It's also their relationship. And I think somebody said they have to have healthcare providers that they trust, that they believe in, And a lot of our folks now, that's one thing I like about the community health centers, because they are really very good. I used to run one many years ago, and they are so much better now in terms of their ability to relate with the community, while they know they just can't come in and do the healthcare and not do it. I think you mentioned that. It's got to be about the community. And they're doing that now. They're stepping out. They're reaching for the communities. Our staff was over at Outreach, and we were at Milwaukee Health Services passing information about, what we were teaching and everything. And that makes so much difference, because they can go in, they know the folks care about them. They're not just doing a job. We need more types of organizations within our community that are like that. We don't have the ones that just to get the money, right? They want to get the money, and if they got the money, they're okay. They do what they do to other people, but just to have them. We got folks that do that. And so I think more and more that's what's opened up to me just watching the whole pandemic piece, is that it is making people think about things. And see, I trust, black people are very smart. That's the other thing. A lot of times people don't realize that we're supposed to be dumb, You know that, right? That's all set up underhandedly within what they've been teaching in schools. They don't call it that, but they really do say things like, well, there's certain communities that just don't pick up things well. One hand up. Excuse me? What are you saying? What is that? I mean, these are universities still, and then our young people start believing that themselves. Even our older people start believing it. So clearly, when we tell our family, you have the ability to listen and to make a decision, and it's your decision, whether it's not somebody else's decision. And it's amazing how that nobody ever told them that. Do as I say, or whatever you say doesn't make any difference. And this is in the spirit, in the place now where this has been almost over a year. We're getting ready to go into the second year. That we have to spend more time on our youth. I really believe on our youth, to get them to talk about what they think about it and what's happened in their families and what they're going to do, because it's going to be critical if you got these kids who still will go to school, well, whatever they turn out to be, doctors, nurses, football players, however they choose to do it, it'll make them think, because we're asking their opinion. A lot of folks don't do that. They don't ask people their opinions because they think they have all the answers already. They talk so much that people don't get a chance. So hopefully, when I say we do these, I would love to see one done with youth. I'll just make that recommendation.
Absolutely.
Marvin, can I just speak to that question?
Absolutely.
Really quickly, because I want to share, first of all, praise the Lord for you and being here today, right? But it is an example that vaccination doesn't exempt you from getting sick, right? And I think that's what the assumption is. If I get vaccinated, I don't have to worry about it. It does minimize the severity of your symptoms. But I want to speak to an even deeper issue that you highlighted, and that's the economics that we have to balance for families that can't afford to stay at home, right? We're working with those families all the time. We had a team member who called, it was late, and when I saw the number, I'm like, oh Lord, what's wrong? And she was like, Miss Bria, I just want to say my partner tested positive for COVID, and I can't afford 14 days off. And immediately my heart sunk, because this is a young lady, she has small children, and no, you don't. You can't afford to take off. So how can we, being mindful of my words, how can we look at the policy in a way that allows for us to support you being able to provide for your family. Because one, I respect the fact that you were honest. She didn't have to tell me that. She didn't have to call and say anything, because who would have known? Nobody. Had she come to work every day, she could have had COVID and gave it to somebody else. Nobody would have known that it was her, that she gave it to somebody. But because she is being mindful, she's being mindful and respectful of the environment that we're living in. How do I support her as an employer? How do I say, all righty? And immediately I went into brainstorming mode with the team. I said, all right, I'm going to suggest that if she tests negative, that she can come back to work. No time off. That means if she go to the doctor tomorrow, get a negative test, the next day she needs to be allowed to return to work. Because a lot can happen in between us being here and going home. And when it comes to our economics, we cannot afford 30 days as a single mother without pay. I had another person. She's like, Bria, I don't know how I'm supposed to live quarantine from my children in the house. So my son tests positive and I didn't. How do I balance this? I can't go to work. I can't even interact with him the way that I need to. Say that again. Your employer didn't pay you. These things are real, right? So this is why people survive. And I don't want to say lie. This is why people survive. They say, you know what? I ain't gonna say nothing. So when we talk about the issue of spread, these are the things that make people say, yep, I got vaccinated. Oh, you want to see my card? I ain't got it on me. But I got it. The fake cards, because, we got the plug. We got the plug, right? And with technology, you can create all kind of documents online, right? But these are conversations we don't have. Stay-at-home orders are privileged, right? That's an order for people that have privilege. I can stay at home and I got laundry. I can DoorDash. I can Instacart. I can order Amazon every day. In fact, it got real bad. I was looking for a package every day. I said, no, this can't be my life. I'm living like them. And so I had to stop it. I said, no, we're not ordering anything. It rubbed off on my children. They're like, oh, look what I saw online. I'm like, nope, we're not going to buy it. That is a position of privilege, and we haven't talked about this, right? We're expecting a community to respond that's already hurting. We want them to take heed to orders to them that don't make sense. I got to go to my job. What you mean stay at home? I got 2 jobs. I got to be at Popeyes and I got to be a CNA. First responders in our assisted living facilities. So when we talk about outbreaks happening in there, I can't lose this money, right? What you gonna do? Who you get it from? I don't know. So you talk about your sister got it in the hospital. Guess what? That custodial person, she had to go to work. And somebody might have been sick at home, but I think it's just a cold. I ain't gonna even worry about it. Yeah, because the cold still exists, y'all. People still get the flu. People still have allergies. I had to remind folks that, like, I got allergies real bad. People start looking at you crazy when you start sniffing these and this stuff. They be like, wait, girl, what's wrong with you? But I just want to make sure that I address that piece that's very, very critical about the economics in our community that prevent us from being able to fully take heed to guidance that's provided.
Thank you. I appreciate it. So I'll go to you. You.
I just wanted to comment about just the vaccines. We've been getting vaccines since the beginning of birth, right? And I always tell people at work when they're like on the fence about getting vaccines, like, okay, we've been doing this since the beginning of time, and now you're grown and you can make your decisions, right? But those things that happened back then were real. There were epidemics, pandemics, all of those things were real. You go back and look at old pictures of polio, all that stuff. And right now to this day, we still get TB shots to go to work and things like that. And for the youth, we hadn't tapped into what's important to them yet, right? So for what's important to grown-ups is that our livelihood. So jobs stronghold you. They start saying, oh, you know what, you're going to wake up resigned. So you have to go and get the vaccine, right? And so what happens, it comes from the top. So OSHA says if you don't have everybody vaccine, you get $14,000 fine, and they looking like, well, you better be vaccinated and you can't come to work, right? And they also doing that to new hires. So I had to turn down several therapists. I'm also a therapist. I didn't even tell you my name. I'll tell you at the end. I also had to turn down several therapists for work because they decided not to have a vaccine. So if somebody has to get turned down for at least $64,000 a year, and they said, well, you know what? Good power to you. I ain't finna take it. I'm thinking about it. Guess what? They all right. They all right. And we'll say, okay, well, we don't want you to come here and you're not vaccinated. You're messing up our herd immunity here at this place. So now we're looking at privilege. I wouldn't say privilege, but capitalism is being disturbed, right? So for years, you can't raise minimum wage. You can't do this. As soon as everybody said they ain't going to work, $20 at Boston Market, right? So right now, what we're doing, we're seeing this a shift in everything. And I want to go back to like what the pastor said. It is a shift, intentional shift. And it started out with everything. I'm talking, we had the pandemic, racism, we marching, we doing all types of stuff. Everything happening at once, right? And now we're coming into we ain't even got, what is minimum wage? We don't know. My job came in and gave everybody a raise. They was like, everybody, you get a raise, everybody. We're trying to raise everybody's limit. You know, right? So now we're looking at all these power shifts. And what are we going to do with it? Because we could go back to a regression. It could be back to 2018, right? So now we seeing everybody can make money, but don't let people fool you. They can't just come to work and make $20. You got to be vaccinated. So now the youth can't get those jobs. They're not vaccinated. And we hadn't tapped into what's important to them yet. And I'm talking about ages 18 to like 25, because, you know, in school you got to get your vaccinations and all that good stuff. But we hadn't tapped into what's important to our 18 to 25-year-olds yet. And the $100 gift card ain't working either. So we need to find out what they need in order to be vaccinated. Thank you.
Thank you. So he had his hand up, and then I'll come to you. So this is my dad, by the way, everybody. And actually, one of the reasons, I'm going to put you on the spot. He put me on the spot at church on Sunday. And he, like me and the rest of my siblings as well, it's 6 of us total. And I mean, one of the reasons why I actually chose to get vaccinated was I remember calling him. It was right before Christmas last year, and there was a bunch of other stuff going on. It was, you know, the marching, like you mentioned, and, you know, I was working from home and really isolated. My mom wasn't doing so well. She was getting ready to go into the hospital and kind of be on a different journey. But I remember calling him, and I remember literally just breaking down. I didn't even say anything. He answered the phone, and I just started breathing hard, and next thing I know, I just bawled out and started crying. And this is just a side story because it kind of went into kind of this year, and one of the big reasons why I decided to get vaccinated, because I was hesitant too, like I know you mentioned, Bria, but the guy is definitely my best friend. I mean, definitely my best friend. And I invited him yesterday, so he could have, like you said, Pastor, or I think it was you, Leroy, said we could be out doing anything. He could certainly be out doing something else, but he decided to be here. So I love you, Dad. Thank you for coming. Now, you can ask your question. I'm sorry.
All right. Now, what I have is more or less a testimony to the vaccine and whatnot. And like I say, this. He don't like to be called, but that's my baby boy right there. And I go to the ends of the earth for him, you know. March 13th, just before, a couple years ago, just before we shut down here in the city, I caught COVID. I mean, my fever was 107. 107. And he's like, Mike, you have to go home. You have to go home. And that Friday, ironically, I work for a school district. Mr. Butler, you were just there, Brown Deer School District, just there. And they said, Mike, you have to go home. I went home not knowing what to do, and this is to your testament, Pastor. God has a way of making a way for you. And I went home not knowing what to do. My fever, I lost my sense of taste. I went from 232 to 216, and that's a lot of weight for me, and I lost that within a matter of a week. And I think it was 2 weeks before I got my sense of taste back or whatever. But not knowing how to make it, I had a boss that went to the school district and fought the superintendent for us. 3 months I was off. I got a paycheck every week. Go home, don't worry about it. You guys are safe. And the lady my boss that fought for us, Jody Smyska, she fought for us and she said, listen, majority of my population are African American men. I will not have them come back to school until we have a way to keep this place clean, to keep my employers and my employees safe, and have them at little to no risk at all of this vaccine. So I am ever grateful for that. I'm also an Uber driver. So to your point, sometimes when people get in my car, I get this double vaccinated. On the platform, it tells you have to have a mask when you get in the car. You have to have a mask. And I get people, well, I'm double vaccinated. Sir, so am I. Well, I got my vaccine card. Let me see it. I don't have it on me. And of course, those are usually the late night bar hoppers that give me that story. And to your testament, in the back, and then one of those, you go, you rear view mirror, you go, you okay? Yeah. It was like, with the coughing and whatnot. And like me, I have seasonal allergies too. So sometimes I get that, where the nose is itching and you get the scratchy throat and all that stuff. And man, it's rough. But I just wanted to share my somewhat of a testimony with you guys. I'm forever grateful. I've always had my boys around me. I got 4 boys, 4 biological boys that are mine, his brothers. And they've always called and say, hey, Dad, are you all right? Anything we can do for you? And there's nothing in the world I wouldn't do for them. And I'm so proud of this young man here. He has his doctor's degree. That is the highlight of me. And I know he doesn't like me to brag on him, but I will tell it to the ends of the earth, man. So thank you all.
Thanks. Love you. There's one more question, and then I do think we have to wrap up, unfortunately. All righty.
My question is this. Anyways, my question is this to the panel, and I think a lot of people are still struggling with, when we talk about COVID, where did COVID come from? I think people are really like, we're being told all this information about COVID, but we haven't even defined or have a true understanding of what it is or where it has come from. So I think that information is something that's being lost in the translation or the communication, because people are still really like, well, how did this even get here? How did it come from watching Chinese people eat rats and bats and talk about a wet market in Wuhan, China, and then end up on Locust Street killing black people immediately? You know what I'm saying? Like, so people still are trying to figure out, where is this thing? And then the other thing is that, Bria, you mentioned the lifestyle, a healthy lifestyle. Why is it that when people are promoting COVID, the COVID shot, they're not promoting the healthy lifestyle aspect of what you need to do? It's like COVID is the only thing, the shot is the only thing that can help you. So I think when you're just putting one, aspect of what health is out there, it kind of confuses people as well. Because why are we not talking about the things that it takes to improve immune system and healthy lifestyle and healthy diet and just all of those things that allow for your immune system to get weak to where you do get COVID? So I guess that's my question. Like, as you're talking about people getting vaccinated, why are we not hearing more of that being coupled with a healthy lifestyle?
Does anybody care to address Ms. Wanda? And then Leroy?
I think you're right. We do have to promote a healthy lifestyle, and I can tell you, I had to make a shift when COVID hit, and we talked earlier about all the platforms, the Zoom and the media, Teams, and so I found myself going from being very active, going to meetings, events, what have you, to sitting in my office or my family room on a computer all day, snacking and eating, which is not healthy.
Not healthy.
It is not healthy. And so I had to purpose in my mind that I was going to get up. I would walk at 5:30 in the morning, 3 mornings a week. And I put that on Facebook. And say, meet me at Brown Deer Track. And there were days we had 15, 20 women. I didn't know who they were. And they saw the post. And I said, and I'm still doing it now. I'm still doing it now. Now, some days I can go out if it's not too cold, or I go to the Y. But you got to look at the full gamut, because it's anything. Even before COVID, you can't just, you needed to exercise. You need to walk. You need to do something. And we talked earlier about, we love, who was it, Bria, talking about, I'm going to eat some macaroni and cheese. But I'm not going to eat all of it. Anything in moderation is fine. And you don't have to eat 5 meals that day because it's Thanksgiving. Eat. And the smaller portions that you eat, your body will get used to that. When you eat a lot, your body gets used to that too. So I think, I don't care how old you are, because I get a lot of folks telling me, oh, I can't walk. I say, yes, you can. You don't have to walk 3 miles. Walk a few blocks. And as you do it, the more you do, the more you'll be able to do. I didn't think I could walk as far as I am now, and I leave people in my tracks. But 3 miles is nothing. When I started walking a year ago, I was panting. But now, right. So it's what you do, and you do it on a regular basis. So we just have to decide what we want to do and make sure that we keep it up.
And I asked a question because I think it's easier to get people to move away from vaccine hesitation when you're giving them a complete.
Right, and eating right. Eating right, fruits and vegetables. There's a young man out in Brown Deer during the pandemic, started a business where he'll deliver fruit to your house on Wednesdays. Well, Wednesdays he does it outside, but on Sundays you order, and I'm gonna mess up the name, but his name is Jalen or something, Greenlee. But what's the name of the fruit company? It's online. Anyway, he delivers fruit to you and tells you why it's good to have those different fruits. And the thing that he taught me that I didn't know, and I've been having fruit for years, he said, when you get your fruit, don't put it in the refrigerator. That's the first thing we do. He said, you leave it out, because when you put it in the refrigerator, you forget about it. But you leave it out, eat it, so when you go to get a snack, it's already out. I don't know if anybody.
It was Dr. McManus and then Bria, and then we have one final statement, and then we'll okay.
I wanted to respond to your question about where it came from. Nobody knows. If they tell you they know, they're lying. I mean, part of it in China, because you're looking to see endemically how things come into, if something happens, they look at endemic. It's the first versus the post-demic when it's all over the world. And so endemic, the first cases were found in Wuhan, China, but nobody's been able to prove that that's where it started, which is from saying that's where they saw it from. There's also some politics in place in terms of believing that it was actually structured, but there's nothing in it that so far I've heard anyway, that says that there's anything that would show mechanically it was made or structured like that. But it's still out there as to where it came originally. Nobody really knows. There's still a lot of supposition and questions, and people are saying they think it came there and the other. But there's no place has anybody been able to find it and then justify and say, yes, this is where it's from, this is where it's from. So I just wanted to respond to that to you.
I appreciate, Dennis, you making that highlight, particularly about the origin of it, right? Because when we think about hesitancy, that's the question. Like, well, where it come from anyways, that I gotta go get this vaccination, and how we know something else ain't gonna come up that we have to get another vaccination for, right? So these are real conversations in the community that happen. And one of the things I think community does well that systems don't do well at all is say, I don't know, right? Systems always wanna try to give an explanation about things that they don't have an explanation for, right? And so when you start to try to formulate a cause, what you do is you further the distrust. Because if that comes back unfounded, well, no, because last week you told me A, B, C, and D. Last week you told me it's because they was eating bats. Now you're telling me it's because they was eating dogs. Which one is it? Now, for me, I don't want nobody eating it. Anyways, but these are the things that cause the distrust in our community. Here's the other thing, right? Systems can be very tunnel visioned, right? To say our issue is vaccination, we can't talk about the other stuff. We can't talk about healthy eating because we can't focus on all these different things. We just need to get people vaccinated. We need to get to 70%. We need to get to herd immunity, and this is all we can focus on. And community like, well, why that's the only thing we talking about? Well, what about my diet? What about exercise? One of the things that we're really, really big at Unite WI is health promotions, right? So it's not just about vaccinations and disease. It really is about your overall health. And we empower the community. Dr. Pastor Fuller has been one of our trained healthy living with diabetes coordinator, where they are literally understanding, how do I educate my community on being healthy and managing their diseases, right? How do we shift the way we cook our macaroni and cheese and it can still be good? How do we make our chicken, you know what? I mean, but one of the things that we need to do better is we need to highlight the influencers who have healthy lifestyles, right? And this is because this is a big shift. One of the things I say one of the things about all the time, right? But here's the reality. When we think about coping mechanisms, right? Food, drugs are the three things that people usually go to cope. Now, folks who are wealthy take vacations, right? I'm stressed. Oh my gosh, I'm gonna go to the Mediterranean and I'm gonna take a 7-day cruise and I'm gonna be back. I'm gonna be amazing, right? We have to go to our corner bar because all we got is $2, right? And we need to get this dollar hour going, and we might have a couple dollar hours going, and that contributes to our health issues, right? Or what? All I got is enough for a Lucy. So let me go get this cigarette to process what I'm doing. Or you know what? Let me go get this Popeye's spicy chicken sandwich that I hate to say I tried once. I only had one once because I had to see what the hype was about. But it was good. And it made me feel good inside. I was having a bad day today. No, it was yesterday. Probably today too. No, I had a bad day yesterday. Let me tell you, I went down to Ashley Q's, the biggest beef rib tips I saw in my life. I said, you can't put this on my plate. He was like, yeah, go ahead and eat it all up. Eat it, I'm gonna give you some more too. No, it was good. I was glad. I got a lot for my money. Lord, I was so grateful. Yes, please go try Ashley Q's down the street. It's really, really good. But we do have to recognize that we have unhealthy coping mechanisms, right? And these are the things that cause us to have these underlying health conditions, make us more vulnerable to disease. And what we need to highlight are the rappers that's vegetarian. One of the things Michelle Obama did really, really well is she engaged Beyonce in a fitness movement. Everybody was moving around. The children wanted to eat the school lunch, and we know how that is. Kids don't be trying to eat the school lunch, but Beyonce said, let's move. And that's what people say, oh, I want to get fit. I want to get in a workout. She's partnered with Peloton now. I want a Peloton. I said, Lord, I hope I use it. But I am. You know why? Because Beyonce is promoting it, right? So when we think about the things that we need to do for our community, for our health, we don't do a good job of highlighting the good in it, right? Vegetarian lifestyle is becoming trendy. Before, people were like, oh, that's for bougie people. That's what the wealthy do. They only eat vegetables. In fact, it was associated with poverty if you didn't have meat. We had to make it do what it do with whatever they gave us. And so this is where we are now, 400, 500 years of psychological warfare on our health, our physical health, our mental health, our social, emotional health. This is what we have to address when we're saying, hey, I want you to understand COVID is vaccination, and I want you to know that your health is where you work, sleep, eat, and play.
No, it's okay. Real quick, then we can leave. This is past my bedtime. Oh man.
You gotta watch y'all.
Yeah, right. It is. My watch is on somebody else's arm. That's what time it is.
Yeah, you're right.
Here's the thing that I always think about. People don't like being told what to do. Like you said, why can't we discuss a healthy lifestyle? I'm telling you what to do, right? Take the vaccine. I'm telling you what to do. Sometimes black people need to stay focused, because if we can just focus, because I'll be honest with you, we know somebody in here going through chemotherapy, radiation, that's poison.
Yeah.
But people take it because it helps with cancer. They take it. As people take medication, and the doctor say, go get this prescription. All black people at pharmacy, they don't read what's in it.
No.
They just take it. So the vaccine is different because it's almost like a badge of honor when the guys, well, I'm not vaccinated. I'm like, I get it, but you taking 50 pills. This guy had, I'm just saying, he take 50 pills a day to stay alive. But he don't want to get vaccinated. He thought about it. He said, you know what, I don't read these pills. So they got these 2-inch names. He said, I never really thought about it. He got vaccinated the next day because he thought about it. The doctor said, take this prescription, because he had gout. You know, big dose with swelling. He had to take this medicine, or they say he got to get an injection right into his toe. He don't even know what the doctor put in. You see medications, TV. They just keep watching. They'll tell you all the side effects. Cause this is it, but they read through it really quick. We still take it. We still take it because, well, you know, with HIV, they got drugs to suppress it. And when HIV was out, we were scared to death because it was in our community. I was still hugging people. You can be trans, gay, straight. You my brother, you my sister, I love you. LGBT community, I love you. Whatever it is can keep you alive, that's what I want for you. I love everybody, but we never read that stuff. But now, I don't know what it is. And I'm gonna wrap up with this, because this is impactful. Everybody say my body, my choice, right? Well, why are you in the way of women making their choices? Get out the way. It's between you and your doctor when you shut that door. But now the door open politically. My choice, my body, I can do it. Oh, I agree with you. But stay out these women problems. That's their business. We don't even supposed to know what come out. When you come out that room, you've made a decision with a doctor. It ain't my business. It ain't none of my business. But I choose to tell people I took the shot, because I want people to say, practice what you preach. Practice what you preach. If it don't pertain to you, I ain't talking to you. I still love you. Because my mama used to always say, hit dog holler.
That's right.
But if you didn't get hit, why are you hollering? To be part of it. But again, as this our community, being here on a Friday night, I agree with your dad. You're a fine young man. Now I know Marvin. Daddy is very modest. Him and Tanisha do a lot with these schools, with my program when people weren't doing it. And then when I saw his background, military and smart and all this, I'm proud of him. This is what we're supposed to be. He was running around doing videos and so I just want to say thank you to the panel. I respect you guys, and I love the fact that we're here on a Friday. I want to thank the people who've come. That means a lot to us. We're going to talk on Monday, young lady. Yep. See, I like being on your program, not like the other big time programs. I want to be on yours. Thank you very much.
Yeah, thanks to everybody. Thank you all for coming out, and yeah.